I saw a light when you passed me by. The reason why I shine, you're the reason why. I thought I caught your eyes, the love is blind.
Good morning, everyone. So it's Tuesday today, my favourite day, because I'm going to be at a GP surgery for the entire day. So one Tuesday every 2 weeks, we're based in different GP surgeries around the area. For me, it's really handy because this particular GP practice is only 15 minutes away from where I live. So I'll take you along today. I'm not too sure how much I'll be able to film just because of patient confidentiality, and also I think we have to keep the practice where we're based quite confidential as well. So I'll take you along and just show you what we get up to on GP day. But usually we get the opportunity to do some consultations with some real patients, so trying to do some examinations, some clerking, and just come up with some differential diagnosis and also some management plans as well. Today the focus is on GI and specifically on alcoholism and helping those patients who maybe suffer with, excessive drinking. So I'm really looking forward to today. It may be a little bit triggering. As you know, one of my parents is an alcoholic, so talking about alcoholism is something that we have to do as a medical student. So I'll see how I go. I think it should be fine, but I really love coming to GP. I think out of everything that we do, it's probably one of my favorite days. So yeah, I'll take you with me and I hope you enjoy. If you're new to the channel, very warm welcome. My name is Bex. I'm a third year extra mature medical student studying at the University of Bristol. So we started off the morning with a sway tutorial and we were looking at liver function tests. So we had approximately an hour to work our way through this tutorial with some questions online. After that, I waited to shadow one of the F1 doctors and we went on a home visit to see an elderly patient who was having some bowel problems. At 1:30 I had my lunch, which was chicken, Greek salad, a yogurt and an apple on that day. So this is the library in the GP practice. This is where we do most of our teaching. Hi everyone, so back from GP now, and I thought I'd just take 2 or 3 minutes to tell you about some of the conditions that we saw today. So I managed to do a consultation with one of the patients who presented with a red hot swollen toe, and essentially he had gout. He'd already had it a few years previously and he presented with this big swollen toe. So the doctor basically prescribed colchicine. So gout is a condition where there is a buildup of uric acid crystals in the joint. It's mainly found in the big toe, and patients can have this because of diet really, or risk factors can include medication or family history. It's always nice to come back home to Clara after the end of the day. You can see her, she's having her dinner. It was really nice to go on a home visit. I'd never done that before as a medical student, and we spent about an hour with this particular patient. The other conditions that we saw were a subscapularis rotator cuff injury. So the GP wasn't sure if it was a tear or whether it was just inflammation, but we got the patient to do several movements like internal, external rotation, abduction, adduction, and it was clear that he was very, very weak on one side and he was in a lot of pain when he was trying to do an internal rotation. That was really interesting, but I find that a lot of the consultations that we have in this particular practice are musculoskeletal related, and I think it's because the GP tutor is actually a specialist in skin and MSK conditions, so we get to see a lot of that. We did a lot of GI, so looking at LFTs, so liver function tests, and what do the blood results mean. We also talked a lot about alcoholism, so how do you actually get a patient to stop drinking, how do you approach the topic as well. So yeah, it was a really good day. So tonight I'm basically gonna head to the gym in a second. It's only about 5 o'clock now, so I'm going to have a cup of tea, get changed, get to the gym, and then tomorrow I'm back at the BRI on orthopedics, and I'm going to take you with me. Wednesday morning, I went straight to the hospital and started the day by myself in the study skills room. We have trust computers that we can use, but on this particular day I had my own laptop. I went to prep on the way and I started a CBL prep for Friday. So we had 2 cases to review and I had 4 questions to answer. Things like what's the difference between a partial knee replacement and a total knee replacement. After that, I did some practice questions. Now I will link this website down below. These questions are very similar to what we have on medical school exams. So if you are a medical student, be sure to check this one out. After this, we had a session on blood cultures and catheterization. In the afternoon, we had a teaching session. For the first 15 minutes, the doctor basically taught us everything that we needed to know about presenting x-rays on the wards, or when we're working in A&E if a patient presents with a fracture or a dislocation. And then we took it in turns in the group to present an x-ray. I had an image of a hip fracture which I had to describe, which was really tricky, to be honest. Good morning everyone, it is Thursday at around 6:40 and I'm just on my way to get the bus. Today I'm going to be in theatre observing some orthopedic surgery with Harris, one of my colleagues, and I'm not too sure what's on the list. I think there's about 4 different types of surgery, but mainly hip replacements, I believe. So I've done a little bit of pre-reading beforehand, just in case the surgeons ask any questions, which I'm sure they will do. And I'm sure I probably won't know the answers to much, but it's okay. I'm learning. It's only day 4 on orthopedics. So I'm going to take you with me to the hospital. Obviously can't show you anything in theatre because of patient confidentiality, but I will show you as much as I can, as usual, to hopefully help you and give you a little bit of guidance on what to expect in your clinical years at medical school. If you haven't already, subscribe to the channel. We're nearly at 1,000 now, which is really exciting, and I'll see you soon. This is actually my favourite part of going into theatre. We actually get to wear these scrubs. They're really comfortable actually. And then you find some shoes, and on this day I managed to find some pink shoes to match my scrubs. And this is going to be a video of me all ready for theatre. Lovely hat, purple hat. So after this, once we went into theatre, we were able to observe the first procedure, which was a repair to a clavicle. And then one of the regs kindly showed us how to scrub in. So this is going to be a video taken from YouTube. So this is not me, but this is just to show you the process. And that's basically just to make sure that the risk of contamination is reduced during surgery. I won't bore you with all of the different steps, but just know that when you're scrubbing in, you can't touch anything with your hands. So you can't touch the sink, you can't touch the taps. Everything has to stay perfectly sterile, and you go through the same steps. So there are approximately 7 or 8 steps, I believe, and you go through them 3 times before you can actually put your gown and your gloves on. So it takes about 3 to 4 minutes. Once you've cleaned your hands, then you can gown up. So you pick a gown with one hand, you pick up the entire folded gown, and you have to be careful because you can't touch anything in the surrounding area which is not sterile. The trickiest part for me was putting the gloves on, because you're not actually allowed to touch them with your bare hands, so it makes it quite tricky. After theatre, I went to get a pret, and then we had teaching in the afternoon where we reviewed examinations on the knee, the hips, the wrist, the shoulder, and this is a video showing the different movements to examine a shoulder, and this is from Geeky Medics if you'd like to check it out. So before I sign off today, I wanted to let you know that we're nearly at 1,000 subscribers, so I've decided to do a Q&A. So send me your questions on a comment or on an email, and I'll aim to answer them. I'll see you soon.